Hi everyone, I'm Dr. Faisal Sayed,
And I'm Dr. Dan McCarter.
and you're listening to Faisal and Friends, where we believe access to primary care is a right, not a privilege. Today, we're talking to Dr. Stephen Kaster, ChenMed's National Director of Gastroenterology, about value-based gastroenterology, removing the barriers of care. Let's dive right in. Hi, Dr. Kaster. It's good to see you again.
Nice to see you all this afternoon.
And thank you so much for taking the time out of your busy schedule to join us as part of our ongoing specialty services series. We started doing this a few months ago, and it's just been wonderful with specialty care, how specialty care is delivered within the full risk model.
It's great. I've been looking forward to this conversation as well.
Excellent. But before we get all into it, we'd love to do a Meet the Doctor. We'd love to know about what got you into medicine? Why did you pursue gastroenterology? And then eventually we'd like to get into how did you end up as a gastroenterologist working for a primary care practice?
Okay. Sounds good. So I was interested in science and math, just like a lot of medical folks in high school, and then ended up pursuing that same study in college. And then decided to go to med school, I think, because, I was always fascinated by the human body and also just fascinated by the way that physicians and other healthcare providers interact with very personal issues that are going on with people and be able to help folks during their time of need. So went to medical school, was interested in a lot of different things. For a while, I thought I wanted to be a urologist. And then, decided to start down the internal medicine path. And once I got through internal medicine, realized that I really loved GI, loved liver disease in particular, and loved the kind of the science behind what's going on when patients have liver problems. So that's what I was kind of interested in. I was very kind of procedure oriented, actually have kind of a short attention span. And so knew I couldn't do like a 5-hour surgery, without, kind of losing my mind. So GI was perfect in that, it allowed me to, do a lot of different things throughout the day, get to meet a lot of people. And that's how I eventually got interested in GI.
Did you have your own practice?
Yes, so I was in private practice in the Kansas City area for a little over 15 years. We had 15 physicians, about 100 employees, 3 ambulatory surgery centers. So, went to kind of my day was kind of, seeing patients in the office, doing procedures in our surgery center, making rounds in the hospital. So it was kind of a nice mix of different things and seeing different problems that patients were having.
And so the big question, how did ChenMed come into your life, and how did you decide to make the change? Why did you decide to make the change to leave your practice to come work at ChenMed?
Well, there's actually a kind of another step in this process as well. As I was involved in my practice, I really got interested in the business side of healthcare, and so managed my group practice, managed our surgery centers, and really enjoyed that part of it. Again, my thought process has always been, I want to make an impact on whichever organization I'm working for. And so as I kind of got more and more interested in the business side of healthcare, realized that I needed to learn more and kind of get more of a foundation for business than what I was currently getting in my practice. So during that time, decided to go back to business school and ended up choosing the Kellogg School of Management at Northwestern. They had an executive program that was actually on site. And so it was every other weekend in Chicago for 2 years. And so did the commute back and forth there while I was still in full-time practice and trying to be a father and husband and all that. And so, it was challenging, but it was really interesting. I really enjoyed the work that we were doing. enjoyed our professors and my classmates. I had a class of about 55, and 5 of those were physicians, which at that time was the most number of physicians they'd ever had in a cohort before. So really got a lot of really great education there. And again, that kind of gave me a platform for which I could then bounce off of and do some, more business focused work. And so when I finished that about 5 years ago, and then I decided that was time for me to change and kind of retire from my clinical practice. And then I started with HCA Healthcare. I was a hospital executive for that organization for about 4 years. Started at a suburban hospital in Dallas, and then got promoted to a bigger hospital in Kansas City, where I'm from. And so, unfortunately, that was, the end part of that was right at the height of COVID, and COVID obviously taxed a lot of healthcare folks, and for me, being the chief medical officer of a hospital, and trying to navigate, that COVID with 300 patients a day, 1,000 employees, 800 doctors, just the stress was was unbelievable, as you can imagine. And also, I was just getting to that point too, and at that time didn't really know much about value-based care. I had been at fee-for-service my whole career and just thought that was just the way healthcare needed to be. Obviously, value-based care kind of had started and sputtered over the last 15 to 20 years, but my practice wasn't really involved in that, and the hospital system that I was involved with didn't really do much in that area as well. So about a little over a year ago, ChenMed reached out to me and said that they were looking to hire a specialist, to help them in their quest, to provide really high quality value-based care. And again, just started talking, and one conversation led to another, and I was just fascinated that there was an organization that actually not only promoted really high quality care in a value-based scenario, but also was mission focused. And that's something that I think all those key pieces were what I was missing, and didn't realize I was missing. I had this kind of general kind of discontent that I was kind of unhappy with the way healthcare was practiced in our country, not only as a clinician, but also as a hospital executive. Just realized and saw firsthand how there were so many people left behind, that didn't have the money to pay for healthcare, didn't have health insurance, didn't have support to be able to navigate, this really, terrible time in their life. And again, we were, although in GI, a lot of our care became more preventative, with screening colonoscopy, but most of the part we were taking care of people when they're sick, and hospitals obviously are that as well. And again, I was fascinated with the thought that there was an organization like ChenMed that actually had a focus on keeping people healthy, and preventing them from being sick. And again, all of a sudden, kind of the light bulbs went off, and I said, you know what, I want to be a part of this organization because, again, I also, as I said kind of earlier, I always want to make an impact in organizations I'm involved in, and I can describe it to people as that, when I was a bedside clinician, I was responsible for 18 patients a day, maybe a little bit more some days. When I was a hospital executive, I was responsible at a higher level for about 300 patients, a day. And now I have the great, fortune of being able to help impact care for thousands of people. And so each kind of step in my career, has allowed me, I think, to have a bigger impact and to be able to apply some of the skills that I've learned, to not only keep individual patients healthy, but keep populations healthy. And that's really fascinating.